What respiratory therapy helps effective coughing in MD? Effective coughing in muscular dystrophy, especially in Duchenne muscular dystrophy, relies on respiratory therapies that support weakened respiratory muscles. These muscles include those that help fill the lungs and those that expel air forcefully. As these muscles weaken over time, the ability to cough effectively diminishes, which can lead to respiratory infections and complications. One key approach is the use of mechanical cough assist devices. These machines work by delivering positive pressure to inflate the lungs and then quickly shifting to negative pressure. This simulates a natural cough and helps clear secretions from the airways. These devices can be used with a face mask, mouthpiece, or tracheostomy. They are vital for maintaining lung health and reducing the risk of infections. Proper training and calibration by pulmonary specialists are essential to ensure they work effectively and safely. Another method is manually assisted cough techniques. This includes techniques like breath stacking, where a person takes multiple breaths without exhaling. This maximizes lung volume before using abdominal thrusts or thoracic squeezes to help forcefully expel air. While this can be life-saving, it may be less effective than mechanical devices and can be challenging, particularly in individuals with skeletal deformities like scoliosis. Breath stacking and lung volume recruitment techniques are also beneficial. These techniques help increase lung volume, improving cough strength, flexibility of the chest wall, and even speaking volume. Breath stacking can be performed using a manual resuscitation bag or a volume recruitment device, ideally under professional guidance. Monitoring respiratory muscle strength is crucial. Measuring maximal inspiratory pressure and maximal expiratory pressure helps assess how well the respiratory muscles are functioning. A decline in these pressures can indicate when to start or intensify respiratory therapies. Early pulmonary care and involvement of specialists are essential. Regular assessments by pulmonologists can help identify issues before significant respiratory symptoms arise. Introducing assisted coughing and airway clearance techniques early can delay complications and enhance quality of life. In summary, effective respiratory therapies for aiding cough in muscular dystrophy involve mechanical cough assist devices, manual cough assistance techniques, and lung volume recruitment strategies like breath stacking. These interventions should be tailored to each individual's muscle strength and disease progression, ideally managed by respiratory specialists. Early and ongoing respiratory therapy is crucial for maintaining airway clearance and reducing respiratory infections in muscular dystrophy. Always consult healthcare professionals for personalized medical advice.